Concern is escalating over the growing Ebola outbreak in the Democratic Republic of Congo. At least one American tested positive and is being treated in Germany. CNN's Brian Abel has the latest efforts in the uphill battle to contain the virus.
The spread of a particular strain of the Ebola virus with no vaccine to fight it is threatening to explode. The World Health Organization says there are more than 50 confirmed infections and nearly 600 suspected cases, with close to 140 deaths suspected to be the result of the Bundi-Bujo strain that's spreading in the DRC and Uganda. And the WHO believes the virus has been spreading for months.
We're several weeks behind. And when the virus takes 2 to 21 days, to incubate, what it means is people have already been exposed. So we're going to continue to see more cases before it can get under control.
At least one American infected, a U.S. doctor who'd been working in the DRC, is being treated in Berlin, health authorities say, while 6 high-risk contacts of that American are being moved to Europe for observation. The WHO, though noting global risk remains low, is concerned with the scale and speed of this Ebola outbreak, declaring a public health emergency requiring an international response, listing 5 reasons: the early spread, cases in several urban areas, healthcare worker deaths, area population movement, and the virus strain with no vaccine or treatments. About 17 tons of lab equipment and personnel are being dispatched from the WHO, Africa CDC, and the Congolese government. The U.S. also coordinating shipment of an experimental treatment to the region for potential use in Americans, according to U.S. Health and Human Services. While the World Health Organization says it could take 6 to 9 months to develop a vaccine specific to this strain of Ebola. Brian Abel.
Well, the CDC is preparing to restrict entry for travelers arriving from parts of Central Africa, where an Ebola outbreak has been declared, in coordination with the Department of Homeland Security.